Hello, and welcome to today's health webinar. This episode is brought to you by our friends at Microsoft. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our moderator, Ahuti Rai.
Welcome everyone to today's webinar on AI for better health, global insights, strategic impact and collaboration. And we are excited to have such a distinguished group of healthcare leaders with us today as we explore this evolving landscape of AI in healthcare across Europe. So to begin with, I would like to invite our panelists to briefly introduce themselves. And as part of that, just to share a little bit of information about their roles in advancing digital health in particular. So let's start with Professor Carlo Tacchetti.
Hi, Aruti. Thank you very much for the invitation. I'm Carlo Tacchetti. I'm professor at the University San Raffaele, and I'm also the director of the AI strategic program at the San Raffaele AI Center.
Thank you very much, Carlo. And Professor Kaki Young.
Hi, I'm Kake Young, vascular surgeon, professor in personalized therapy in vascular surgery, and also the president-elect of the European Society for Vascular Surgery. I am I'm also the lead of the Vascular Consortium, which is actually implementing artificial intelligence into the working floor, making prediction models in cardiovascular disease progression prediction. And yeah, I'm very happy to be here.
Thank you very much, Kaki. And Dr. Markus Vogel.
Yeah, hello. Thanks for the invitation. I'm Markus Vogel. I'm a physician by background and now work as Chief Medical Information Officer at Microsoft. I spent about 15 years at the bedside in pediatrics, intensive care, so I know how challenging the clinical workflows can be. For me, it's about outcomes. That's why I'm passionate about using AI to support healthcare professionals, not to replace anyone, but help us to deliver better care. So that's really what's driving me, and I'm looking forward to sharing some insights in just a moment.
Thank you, Marcus. It's actually a good time for me to turn the floor over to you at this point. And if you can guide us through the key findings, trends, and implications of the Microsoft study, AI Frontlines in Healthcare, and then we'll launch into a Q&A after that. Thank you.
Sure, I'm more than happy to do so. So let me share my screen first. Okay, so can you see my screen?
Yes.
Could you please confirm? Thank you. Okay, so then I'm happy to start. This is just the disclaimer. So let's jump right away. Here you go. So thank you for joining us as we explore the front lines of AI in healthcare. Today, I share the latest findings from our 2025 study and discuss how AI is transforming care, outcomes, and equity across the healthcare sector. Across the globe, technology, research, and collaboration are converging to enable better health outcomes, and AI is actively reshaping how care is delivered, empowering clinicians and patients along, and driving health equity at scale. Now we can take a look at what's driving this transformation. So let's look at the context facing healthcare today. So healthcare is at a turning point. It's a crucial turning point. Patient expectations are rising on one side, and workforce shortages are straining systems on the other side, and simultaneously operational pressures are mounting. And to understand how AI is addressing these challenges, we commissioned a survey of 427 hospital leaders across Europe and Australia and conducted in-depth interviews with my colleagues, also our healthcare experts, from March to June 2025. So this is what we found about AI adoption in hospitals. The results are quite significant. every surveyed hospital leader is exploring or already deploying AI. And even more, 78% are investing in generative AI for clinical care, applications like automatic clinical documentation and diagnostics. So it's the whole picture and everything what's important in healthcare. So we can note a global transformation is already underway while we talk. But how is this adoption translating into real impact? AI is already making a difference. 41% of hospitals have implemented clinical AI applications already, and 37% are using AI for business operations. So generative AI helps hospitals work differently from resource management to patient care. So if we take a deeper look where AI makes the biggest difference, we will see the strategic priorities. So hospitals are prioritizing AI where it matters most, and it's roughly 1/3 of each group. 37% focus on improving operations, 36% leverage predictive analytics for better outcomes, and 32% they directly look at automating clinical documentation. And when we compare those priorities across countries, we see that hospital operations management stands out as the top focus in the Netherlands, in the UK, and Germany. And for the Netherlands and the UK, automatic clinical documentation is also a major priority. You will find these numbers in detail in the full report. At the end of the presentation, you will see a QR code where you can then get access to all of the results. Importantly, AI benefits extend beyond hospital walls. This is a very important finding of the study, that AI is a powerful technology for health equity. 96% of the leaders believe AI will improve population health in general, and over 99% see it helping rural and remote communities. This is about equitable access and better outcomes for all and everywhere. But this power and these opportunities, they come with great responsibility. So it's about responsible AI. And 97% of leaders say that responsible AI is a top priority, and over a third have human oversight of AI decisions in place. Hospitals are leading the way to ensure AI is safe, ethical, and transparent. So it's not out of the hospital walls, it's in the hospital walls where the way is led. Despite this progress, which is notable, challenges remain. 41% of hospitals cite integration challenges, 39% point to a lack of expertise, and 38% mention cost. These are real barriers, but hospitals, as we see, aren't waiting. They are taking action right now. So this is also about investment. How much are hospitals investing in AI to fuel the transformation? We see that the transformation requires significant investment, and nearly half of the surveyed hospitals allocate 11 to 20% of their IT or innovation budgets to AI. So it's the IT or innovation budget, not the overall hospital budget. And larger hospitals are even more investing in AI than smaller hospitals. So this strategic investment paired with partnerships is key to unlocking AI's transformative potential. It's about collaboration. Collaboration with other hospitals and technology partners across borders and sectors is key to scaling impact and multiply effect. We have to see that scalability is important, and bringing together clinical and technology expertise is a collective power to drive sector-wide transformation. Clinicians and technicians along they drive this sector-wide transformation. It's not one or the other, it's both. So this is the moment to channel exactly this collective momentum, to have both sides or both groups to work along to shape the future with AI for better health. So this AI revolution in healthcare is already here. Every hospital we surveyed is on this journey already. And together we have both the opportunity and the responsibility to shape the future and deliver better health for every patient, literally everywhere. And now you can also scan the code and have the QR code ready to discover insights from 427 hospital leaders and Microsoft clinical experts on AI adoption, impact, and responsible innovation. And I'm really happy to discuss this further. So thank you very much.
Thank you very much, Marcus. And actually, if I can start with our questions and continue with you first, please. So according to this study where you've just showed us some of the findings, nearly all of the hospitals surveyed are actively exploring or implementing AI. And in your view, what is the big driver behind this, this widespread adoption? Like, what is it that you can pinpoint here that's causing this this widespread adoption?
Yeah, I was quite happy to see that this adoption is so widespread. The biggest driver is the need to improve operational efficiency and secure or improve patient outcomes. As I mentioned already, there is this burnout risk and shortage of healthcare professional personnel. So we have also literally secure the outcome and not only to improve it. And we are in a rapidly changing healthcare landscape, and the hospitals are really facing rising demand and the workforce pressures to do more with less. And this is really the biggest driver. And we see that AI offers practical solutions. I mentioned the automating documentation or supporting clinical decisions or optimizing operations. It depends in various markets what comes first. And this is why almost 100% of surveyed hospitals are experimenting or exploring or implementing AI.
Thank you, Marcus. And if I can ask a question to you, Carlo, how are clinicians and staff being trained or engaged in AI adoption? This is a new discipline, it's a new skill set. So how are you approaching this?
Well, let me first say that as an MD and oncologist by training, I was trained many years ago. So I'm 68 and my knowledge of AI was quite low. So the first need I faced for myself was the need for information and education. And based on these needs, we actually built into our hospital two programs that go one after the other, one for the undergraduate students. So we try to teach undergraduate students both in the med school, in the nurse school, aspects related to AI, which are mostly foundational literacy. So what is generative AI? What is machine learning? What is deep learning? And then we move forward to compliance knowledge, compliance with GDPR, EU Act, ISO 42001, what it means to be compliant with regulation in order to be using AI in a responsible, trustworthy, and explainable manner. But then there is something more than we have to transfer to the new generation, which is the governance of the AI. So we feel that our students, and then I will move to the professionals, have to start thinking that AI is not an automatic process that is modifying, it is modifying the way we approach medicine, but it is not substituting the role of doctor. So we have to be responsible in understanding when to use an AI solution that has been that is suggested to us, and when we can actually discard that solution if we don't feel confident on that. And also we have to teach that feedbacks are very relevant. Whenever we use an AI solution in a predictive manner, well, that prediction, if it is used, will change the panorama of the patients we are facing, and so in time that solution will be old, and we have to understand when that solution, because the panorama has to be changed. So we need something like aftermarket surveillance for any solutions. So this is for the undergraduate, but then the same skills, but more oriented on the specific specialty of physicians. But we should not forget nurses, because in hospitals, the professionals that collects data are mostly nurses, not physicians. And so they have to be trained in collecting data in a clean way, in a reliable and reproducible way, and so on. And then, of course, the clinician, and to them and to all these professionals, what we are teaching to our students is applied, but more in a specialization-oriented manner. So we have also specific courses for radiologists, for oncologists, for cardiovascular people, teaching which are the platforms and the solution implemented into the hospital, which are the pros and the cons, and which are the responsible activity they have to face in order to use responsibly those solutions.
And if I may, Carlo, I'd like to just bring in a question from the Q&A because it links so directly to something you just said. And we have a question around the impact on nursing. So how are you seeing this impact nursing specifically, and is it being adopted by the clinicians actually using it? If you wouldn't mind just elaborating a little bit on your point around nursing that you just made, so we can also address this question.
Well, first of all, let me say that the core of an hospital are not physicians, are nurses, actually. And so they should be part of the entire process, if not sometime leading the process in the daily practice of a department, clinical department. So what we have done here, we have started 2 courses, which are second level degrees, master degrees. One is for what we call the research nursing. So these nurses are trained for in order to be collaborating with the research departments in our hospitals, and we perform research mostly in trying to develop predictive models in therapy response and prognosis. So they're active part of the research teams. And on the other hand, we are also, since 2 years, we started another master degree in health informatics, to which we accept nurses, physicians, engineers, physicists. So any type of figure that can be implemented into a pipeline of deployment or development of AI solutions in the hospital are being trained. So going back to nurses, I think that they need to be trained as the physicians. Otherwise, we will not succeed. As again, they are the core of any clinical department. They will be using some of the machine, they will be analyzing some of the data, and they will be collecting the data. So they must be trained.
Thank you very much, Carlo. And part of that question actually links to something I'd like to ask Kaki. So how do you address potential resistance to change among healthcare professionals in your hospital when you're introducing these new AI technologies? And if I may just add in a second part to that question, which is coming from the audience, which is how to get doctors and technologists to also talk with each other as part of this change management.
Yeah. So thank you for that question. So I have to say that the landscape is changing really quickly. So what we have seen is that 10 years ago, when we started about this research projects on AI and then implementation of AI, people were really scared and they didn't believe in it. But right now, I can see in my hospital, we have actually working groups of how to get AI implemented, how to gain trust. So every hospital, all the hospitals in the Netherlands, the university hospitals are sharing and collaborating what is already implemented in their hospital and how to overcome these hurdles and the trust. But because AI is everywhere in the news and you have these open sources, people are getting used to it, and they are actually also more people trusting the outcome of the AI without even actually being tested really well enough, but because they are really overwhelmed with artificial intelligence techniques, they are now in their head, it's already changing. So there's not much convincing to do right now. It's just more like how to get a more trustworthy environment, how to get a responsible AI, how to train indeed all the healthcare professionals, including nurses, the technicians, and everyone. And everyone is willing to collaborate. So that is for sure. But I guess it's all about the working groups and to see what is a good solution that we can bring in together, because of all these new technologies, it's just not like one company is offering it, but actually 20 of them. And so which one to choose, how to trust them, and how yeah, and that actually is now, I guess, the biggest hurdle to overcome, which one to choose, what to trust. Um, so there's not really potential resistance right now in using AI in the hospital because it's getting used, as you have seen in the Microsoft study. But it's more like, what is the best one? It's really difficult. And this is where I think we do need to inform each other a little bit more about. Yeah.
Yeah, okay, super. I'd like to come back to you actually because you talked about a few things there in terms of ethics and responsible AI and trust, really important points. And I'd like to come back to you in a moment, if I may.
Yes.
However, let's maybe go back to Marcus, and perhaps you can share a real world example where you've seen that AI has made a measurable difference for patients or for clinicians. And yeah, if you can talk us through a real world example, and then some of the following questions, we can actually use that example as well.
Yes, I'm happy to do so. In general, AI is a term that today is mostly defined as generative AI. So if we talk about AI in hospitals, that has been around for a very long time, to be honest. But now talking about generative AI, one of the earliest and most impactful examples, it has already been mentioned, is for processing clinical documentation. And this is what also was reflected in our study, that 32% of hospitals are putting priority on AI to reduce the administrative burden on clinicians and nurses. So, and this means helping healthcare professionals spend less time on repetitive tasks and more time with patients. This actually leads to better care experiences and less burnout. So that's why Microsoft offers the clinical AI assistant, Dragon Copilot. This has been implemented in the US, in Canada, the UK, Ireland, Germany, France, Austria. So it's quite a significant number of regions. And in addition to that, as what we call a frontier firm, Microsoft is directly helping hospitals to harness the next wave of innovation, which is including the emergence of agentic AI. These are AI systems that act autonomously and proactively to support clinicians. And this is the next wave of transformation of healthcare. And obviously, there are a lot of regulations to be looked at. And we heard about that already, that it's all about responsibility and trust. And this is where we directly look at and what's really important to us.
And Marcus, if I may, just to extend that question, because there's a question from the audience here around are most healthcare systems developing their own AI system, or are they using off-the-shelf systems? How are they dealing with the issue of patient privacy, protected healthcare information? So if what we're seeing is really sort of this wave of generative AI, agentic AI, if you would help us answer that question specifically around whether they're developing their own or using off-the-shelf systems.
I think there is no general answer to that question. I believe that systems that are, so to say, off the shelf can be better controlled and could be more trusted in if they have proven results. But I would say what is really important if you use your built-own systems, that you rely on a trusted infrastructure to scale your own systems within your organization. So still, even if it's your own system, you have to bring it to the point of care somehow. So you need what I call an AI infrastructure to do that. So maybe it's not the question to use the one or the other to make or buy. Sometimes it's the overall question on what infrastructure I rely on.
Thank you, Marcus. So Kaki, if I can come back to you, because part of that audience question there was really around dealing with the issue of patient privacy, protected healthcare information. Earlier on, you touched on the importance of responsible AI, ethical AI being in terms of how we implement. So would you be able to help us understand what are some of the practical steps that hospitals and clinicians can take to ensure that any AI solutions that are implemented, it delivers real value, but it's implemented in an ethical way? We are being responsible with these AI implementations.
So thankfully, we have the European AI Acts in Europe. So when you have your own solution or a generative AI solution or a solution that has been offered off the shelf, you have to see what kind of impact it will deliver to your patient. So is it a high impact? Is it a low impact? So when it's a high impact, it definitely needs some kind of an evaluation method to see if it's really trustworthy. And, you have to go to a lot of legal steps. So it has been touched upon earlier a bit, but you definitely need a specific infrastructure in your hospital. So these are the practical steps. So like what are you implementing? This is step one. So is it, and what kind of impact has it on the patient is step two. So administrative is a little bit different than a predictive model, right? So when you have like an administration task, it is some way the automatization is gone. So you have well, do you need human oversight for it? Yes or no? But in the prediction modeling, where you actually change the course or the treatment of your patient, then you definitely need human oversight. You need a person, you need a doctor that looks at the solution, that see if the AI solution was actually this something that you would have done as a doctor. Is it safe for the patient? So these are things that you need to do. So first of all, where are you going to implement the AI? What kind of solution is it? What is the infrastructure that is needed? And then what kind of impact has it for it? So for example, we have made an AI solution in our hospital for automatic analysis of the diameter of the vessel. And that means we take away a little bit the working load of always measuring the diameter of the vessel by the radiologist. And then they can concentrate on something else, or to standardize actually the diameter measurements, because for an aneurysm follow-up, it's very important. So it offers standardization, and it offers that the working load for the radiologist is less. However, the radiologist still has to look at it. And it does have impact on the patient. So that's why we still need the radiologist look at it. And you need like an overlay system of how the AI was predicted to the outcome of the diameter, like an overlay of what has been predicted by AI and what was measured by the human measurements by the radiologist, and to see like, is this comparable, yes or no? So I think this is something to gain trust. So that's one. And secondly, also, this is how you implement AI, just to, make it visible as well for the clinicians and the patients, actually. Yeah.
Yeah, that was great. Thank you. Really practical. And I guess the other side of that conversation is for hospital leaders. So maybe, Marcus, a question for you, actually. So for hospital leaders who are just starting with their AI journey, so, the survey talked about those that are, actively exploring, but also implementing. Some are earlier on in their journey, they're still exploring. And what advice would you give to them, Marcus, as they're just beginning the AI journey and making these investments?
Yeah, good question. Be curious and start with clear priorities. So this is, I think, what matters most, that to really focus on areas where AI can have the most immediate impact. And we already heard there are different versions and kinds of AI, like measuring the vessel diameter is something completely different than, let's say, use generative AI for administrative burden. But the most immediate impact in general in a hospital could be clinical documentation, operations management. So invest in building a culture of trust and responsibility around AI is key. And to not or don't hesitate to collaborate with technology partners or peer institutions. So you don't have to do all by yourself and alone. And finally, ensure that the teams are trained. We heard that already, that there is this kind of AI literacy that builds trust and also makes the teams responsible alongside, that they can really rely on your own institutional systems. And this also brings strong governance in place. So it's really a journey. So I think this is not just a switch AI turned on or off. And we see that the most successful hospitals are those that combine the innovation with really responsible and knowledgeable leadership. So what I like most, to be honest, is when it comes to AI and the question is, okay, how can Microsoft help, or how could we leverage the clinical AI assistant for clinical documentation, for example? Then actually the projects are most successful if there is the clinical leadership alongside with hospital management, alongside with the hospital IT, along with implementation partners. So really peers or companies from the outside that help this hospital group to implement AI. And then this is most successful. And obviously, it's helpful to build this group in the very beginning. So not to wait until this or that project maybe comes far along and then to realize that it's going to nowhere, but really to do that upfront and to discuss everything in the very beginning, including the data privacy officer, looking at the governance issues and all that stuff. And then most likely you will have successful AI projects and really become a frontier firm.
Thank you, Marcus. And staying with this theme around responsible AI practices, Carlo, a question for you. How are European research projects and hospitals adopting these responsible AI practices, but in particular, how are they balancing compliance with innovation, and especially through European initiatives? What kind of best practices are you seeing which ensures ethical and trustworthy AI deployment?
Well, this is a very important question, and I would like to address it first, just giving some information on what the status of the scientific publications are. So if you search PubMed for AI and medicine, you retrieve about 230,000 publications from 95 to 25. Now, less than 16% of this publication meet the minimum quality standards for data quality and exploratory data analysis. In particular, we just made an analysis on about 300 papers on metastatic colon cancer, but surprisingly, 268 of these papers never performed an external validation. Benchmarking of models against existing clinical practice, it's quite rare. Most of the models are black box and not white box, so not fully explainable and so on. So this already says that there is, first of all, an academic education. So we mostly make career by publishing, and instead we should be more as an objective reaching what we have to measure is how much you have impacted on patients' care with your solutions. Now, based on this experience, we created, together with many other European hospitals, a European network that pairs the analogous initiative made in the US. The European initiative is called EU TRAIN. TRAIN stands for Trustworthy Responsible AI Network. So the goal is exactly the answer to your question, how basically what we aim for is not so much to change the regulations, but to identify processes and protocols standardized in order to be compliant with the regulation. For the regulation, I mean, not only GDPR, paradoxically, the privacy is the least problematic issue we have, but other issues like trustworthiness, like explanatory AI, reproducibility, security are more cogent than privacy in terms of solutions. So we have to move as Europeans to comply not only with the GDPR, but also with the EU AI Act, with the NIST Risk Management Framework, with the ISO 42001 regulations to managing AI solution and so on. And that's what we're actually doing. Then based on this activity, we actually published on JAMA a recent paper reporting some of the solution and the requirements we think should be fulfilled by EU TRAIN members. So we need to work as a team. Then there is a deployment phase. So how do you deploy these standardized processes into practice? And that mostly depends on the platform, on the clinical questions that are on the table. Personally, I'm not so much in the field of developing diagnostic tools, which are the most successful area in AI in medicine so far. We have many AI-based diagnostic tools. I'm more interested in predictive AI. So I want to predict the prognosis of patients or the therapy response of patients. Well, in that field, most of the failure we have faced in the literature depends on the non-compliance to minimum quality standards.
Wow. Okay. Thank you. Thank you for that very comprehensive answer, Carlo. I want to kind of switch focus a little bit, and we haven't really talked much yet about interoperability as such. And we've actually got a question from the audience as well. Is interoperability really being implemented, or is it something not interesting to some organizations, obviously linked to the competitive aspect of becoming interoperable? And so maybe a question for Kaki initially is, I guess, how does greater interoperability and data sharing between hospitals, technology providers, and clinicians accelerate, this transformation and lead to more integrated care pathways? But also, is it really being implemented? Is it still a concept? What are some of the barriers to it?
Yes, so the data sharing is something I think the EU will address soon. about how the data will be used and will be shared across Europe. And for now, I guess we have to rely on how to deal with maybe synthetic data sets and how data actually will be used per clinic, and maybe think of federated learning infrastructures that we can use to set up the AI prediction algorithms for. Because I think for simple things like the administrative tasks or the automatization, that we can use off-the-shelf solutions for. But once it comes to predictive modeling, and we need actually the data from that hospital and also the course how the patient is going from one hospital to another hospital. So that infrastructure is definitely needed. It's not there yet. We still have to figure out how to, use the data of the patient without violating the privacy. So we cannot use the number, social security number. We should give them another type of number, and that they come from every hospital and we can follow them. We need a federated learning database and also storage of data and coding of data need to be automated. So what we want is actually that the systems, the electronic health record systems, are mapped with medical codes words like OMOPs. These are coding words that you then automatically extract data in a structured form and standardized form. And that exactly the same all over Europe or the world. That would be great. Then you have a standardized type of collection of that data, which you then can use, of course, to feed in the AI models in a standardized structure. Because what you feed in the model for the prediction is very important. So the data collection needs to be standardized and structured. So this is one. And then it has to be the same in every hospital. So the infrastructure needs to be there. So I would highly suggest that the government somehow is going to invest in this, that the hospitals are going to be connected to each other, and give, another social security number, but other type of number to the patients. I think that is the practical step, what we do need. Thankfully, the European Commission is thinking about how to deal with the data on the sharing level, but not yet on standardization and structuring. So that's something that we, as clinicians and healthcare professionals, still need to think about together to come to that predictive modeling. But data is so important. Yeah.
Thank you for that. And I noticed that you had already answered this question, but if you don't mind, I'll bring it back into live mode,
Yeah, sure.
because there was a question around how comfortable are hospitals using models that are not trained on their own patients' data, and it links to what you were just saying there. So I just thought it might be worth answering that live for the
Yeah.
benefit of all of the audience.
They usually are comfortable. So once it's off the shelf, these systems are pretty well trained on other kinds of data. However, if you come to predictive modeling, you do need data from your own hospital or your region because it's otherwise different. So it depends on the impact again on the AI Act has several impacts. Like if it's in high impact, that will differ the treatment course of the patient. Then you need human oversight and you need to have to be trained in your regional data or evaluate it at least, like an evaluation validation step. Um, and I highly suggest to use out of distribution filters just to see, if sometimes this is predicted, but then you know that that system was not trained on your data or it was trained on data that was similar to your data. So the clinician knows like, oh, okay, this answer or this prediction outcome was actually not trained on data. So you cannot trust it that much. So you can use it, but then you have like a highlighted button like, okay, warning, this might be not trained on your data. And then the clinician can think, okay, is this a logical answer? Yes, or prediction, yes or no?
Yeah, and I guess this links to, again, thank you for being so efficient answering some of these questions in the chat, but it links to one of these other points, right, which you've already addressed, which is how do we ensure meaningful human oversight when AI systems are used in clinical decision making? And, you know, your point there was it depends on the impact. So the clinician ultimately will be the one to take the responsibility, and that links to this point around, you know, the data that was trained and how it will be different as well in every situation. So yeah, thank you for addressing some of those points. I have a question before we actually come to the audience questions. I've got one more question for you, Carlo. I'll come on to that. But in the meantime, if anyone does have any more questions that they would like to put into the Q&A, we'll come on to those in a moment. So one more question, I guess, for you, Carlo. It's a bigger question. It's a broader question. What is your vision for the role of AI in transforming healthcare across Europe, let's say over the next 3 to 5 years?
Well, that's a huge question. So I honestly unable to answer because we are spanning years, but changes may come in weeks or months because they are going so fast. I certainly see, and I want to quote some of the statement Kaki made on the need for infrastructure federation inside Europe. So most of the applicability of the solutions we will develop in the next time will depend on how much we have been able to federate and the infrastructure used to develop those solutions across Europe. So platforms need to be federated. They once they are federated, we can work on common language, on common standards, and so on. Most of the solutions are actually coming as standalone solution from single hospitals. Okay, although they have been validated in other hospitals, they can be used almost anywhere, but the training courts are usually regional courts. So the real I think struggle will be in the next future, and on that will depend how much time we will see sizable results. Will depend on how much we will be able, under the European Commission head, being able, once we have started working on consortia to develop solutions, how much we will be able to federate these solutions at this platform together. Now, there are, in terms of machine learning and deep learning solutions, I think, again, we are almost there. Many solutions are in diagnosis are already there, and they are already impacting. Solutions in terms of predictive medicine will be soon available. As for the generative AI, I would say that mostly will impact on managing, and agentic AI will mostly impact on managing issues more than on predictive prognosis or therapy. But I hope I'm wrong, because I really hope that it will work in that field. But as for now, I don't see generative AI still safe in generating predictive models in many diseases. So I'm sorry I didn't ask precisely to your question, but it is really, I don't have my magic ball to look in for the future. And this field is going so fast that I really don't know how to measure the success, whether in weeks, months, or years.
I think it's a sensible response, Carlo. Thank you for that. We're going to switch to some of the audience Q&A. I've been trying to weave them in as we've been having our conversation, but we still have a few more questions. So we may be jumping around here in terms of themes of the question, and I invite any of you to step in to answer these as you see fit. So we have a question around collaboration. And Marcus, I think this links to something you said in your presentation. It was stated that collaboration is key to scaling, and that is supported by the challenges of integration and expertise. With what stakeholders, so with whom is collaboration critical to overcome those hurdles? And can you speak more to the specific integration challenges and solutions to overcome? So it's from the presentation, but of course I invite any of you to address that question, please.
I don't know whether I understand correctly that, I mean, I already mentioned a little bit that you have this technical expertise and this clinician expertise work together to get your results. And this is what I heard from the other panelists as well. And I think this is exactly the case, that it's about defining the outcome first on a management level, and it's also to see a patient-related positive outcome. That's also important. So the stakeholders can vary a little bit. Sometimes maybe it might be more the technical part, talking about interoperability. Sometimes it might be more the nursing part or the physician's part, or sometimes it might be a board or a regulator who needs to be involved to get things done, or to understand how to get things done correctly. So I know it's kind of a broad answer, but I think it's the most honest one, that there's no definite answer. I don't know what the others say. So please, I'm interested what you're saying.
Well, I think in terms of collaboration, also the last question, what new roles in healthcare do you think will arise out of this AI revolution? I think that technical physicians and will be playing a larger role. And these are new professions that are clinicians. They treat patients, but they also have a technical background. So a lot of new roles like this, but it's also not really a new role like a healthcare professional like I am. I'm a vascular surgeon, but I also have background in data science. So you get like a combination of things to work because yeah, I think 20 or 30 years ago you also had to learn to to type or to work with your computer. And right now it's just another skill again to also work with AI as well. So I guess it's not only new roles, but it's also about new training, education, and maybe a different shaping of how a doctor will be at one point. Yeah, just go with the future technologies. Yeah.
Thank you. Thank you for those responses. Any additions to the question around the new roles? Anything from yourself, Carlo or Marcus, to add to what Kaki said there?
Yeah, I mean, I was talking about the frontier firms, so the organizations that really are advancing care and look at how to implement AI even further, and looking at we define various phases. If you look at the last phase where you have agentic autonomous systems acting together, then I think a very interesting role might be someone like an agent boss, a person who oversees all the various systems working nicely together for better care and for better outcomes. I think this could be an interesting role in a hospital.
Mm-hmm.
If I can add on that, there is one actor in this game we have not talked about, which are the patients. We, of course, we concentrated on professionals, but I think one of the most scary scenario I'm really afraid of is the autonomous use by patients of generative AI solutions to auto-diagnose or even worse, auto-prescribe therapies. So we should also think of other figures which are maybe sponsored by patient associations and so on, which, again, going back to education and information, try to transfer this incredible scenario that is facing in front of us to the patient. So AI can be, as any new tool, can be dangerous. It can be helpful. So as professional, we can be trained in using it in the correct way. People that's not been trained in health professional then could be more weak and more more able to use tools in the wrong way. So we should also think about the possibility of preparing some figures that are able to transfer to the common people the risk and the advantage of AI. It's easier for professionals. It's less easy for the common population.
Thank you. And just with a few minutes remaining, let's try and briefly respond to the remaining questions. There's a theme here around clinical validation so the landscape of clinical studies for AI solutions, and whether you have anything to share on that. So clinical validation with a proper methodological approach is needed for AI solutions that deal with diagnosis, therapeutics, or prediction. So what is the landscape here? How is that landscape of clinical studies for AI solutions?
Yeah, I can take that one. So I also answered another one that was asking how to validate in non-imaging studies. I would say it's not validation, but you should focus on visualization to get also the trustworthiness there. So visualization next to validation. And the clinical validation with proper methodology approach is usually using the 10PP methods based on the logistical regression methods. So the nominal statistical methods, and also maybe sometimes you need to have a randomized control trial even for AI solutions. That will change the treatment course. Yeah.
Thank you for that. And let's maybe take one more question, or there's a theme, I guess, across a couple of questions. I think some people in the audience are looking for some practical next steps. And I know, Marcus, you touched on this earlier, but, any practical next steps, any studies to help implement new AI in a hospital or a unit, how to start teaching something like this in nursing school as well?
We touched that already. So to really start with, it starts all with information. It starts with looking at the clinical need with all the different stakeholders. So is there anything they want to change? And I believe yes, in 100%. And since we heard that 100% of hospitals are already looking into AI or what to do with AI, it would be really helpful inside an hospital organization if there's some kind of information flow. Sometimes one is doing stuff others don't know from. So sitting together, talking and talking leads to better care for everyone. I'm really sure that this is key, and then you can implement the solutions.
Thank you very much. And unfortunately, we are at the hour. 2 questions remaining. Sorry to those audience members that we couldn't get to your questions. I'd like to thank our panel today, Carlo, Marcus, Kaki. You've provided us with such great wisdom and guidance in a practical way as well. So thank you very much for taking the time. And thank you to our audience for tuning in, and have a good rest of the day, everyone. Thank you.
Thank you to Microsoft and to everyone that joined us today. Please visit our website, HLTH.com, to catch up on all health webinars and watch the recording of today's session. Join us in Los Angeles, February 22nd to 25th for Live.